Hi everyone, my name is Adam Sealey. I'm an award-winning back pain specialist and osteopath, and today I'm going to be talking about how to know whether or not you have a weak core. But before we get into that, let's just quickly discuss what your core muscles are, because a lot of people will have a rough idea of what it is I'm referring to when I talk about core strength and core stability, but that's about as far as it goes. So your core muscles are essentially the muscles around your trunk, and there are a lot of them. People tend to focus on the main ones or the biggest ones, such as transverse abdominis, which are the muscles around your abs, as well as the erector spinae muscle group, which make up a big part of your lower back. There are a lot more than that though, and they often get overlooked, but with names like intertransversae lumborum medialis, which is just one muscle by the way, I'm not going to be listing them all here. So the importance of having a strong core is that essentially we use it in all day-to-day activities. There are just so many muscles involved in that area, it's hard to not be using it to some degree, and having a weak core can really have a negative impact on the body's ability to function and can lead to injury. So the big question is, how do you actually know if you have a weak core? And that's actually a tricky question because there's no official test to determine that. And it's not something that's based on your age or height or anything like that. The thing is, a big part of it comes down to genetics. However, there are a few telltale signs, and one of the most common is having a bad back. Studies have shown time and time again that in subjects with a bad back versus those who don't, those who have a bad back have a weaker core compared to those who are completely pain-free. So another way of saying that is if you have a bad back, you're almost guaranteed to have a weak core. And if you have a weak core, you're almost guaranteed to start struggling with back pain. And this doesn't even have to be constant pain either. This can be pain that comes and goes, because after all, if it was completely fine, the pain wouldn't keep coming back. So another indication of a weak core is having a bad posture. So if you ever find yourself slouching forwards when you're sitting or standing, or not being able to hold yourself upright comfortably without thinking about it, this is an indication that your core muscles aren't perhaps working as effectively as they could be. So another sign is that your back arches while you walk. So you might find you have a deep curve in your lower back. This tends to happen due to tightening and shortening of muscles in the front versus the back, causing the pelvis to tilt forwards. Another sign might be that you start using people or objects as a bit of a crutch. You're holding onto them for support. And this might sound a little bit extreme, but if you think about maybe some elderly relatives, it's not actually that uncommon. However, if you're 80, 90, then fine. You know, we all get a little bit weaker as we get older. But if you find you're doing this when you're 20, 30, 40 or whatever, then that's obviously not a good sign. The only other clinical way that we can monitor core stability is with a movement called unilateral hip bridge endurance. The idea being that you lie flat on your back with your knees bent and your feet flat on the floor, and then you can lift your bum up off the couch and your hips towards the ceiling. And once your hips are up, you then straighten one knee out so your leg is straight and thighs are parallel to one another. You then hold this position for as long as possible. So this exercise kind of gives you a baseline to gauge. It doesn't determine exactly whether you have a strong core or a weak core. It's not as if you hold it for over 30 seconds you have a strong core, but if you can't hold it over 30 seconds then you have a weak core. But the study showed that this test directly reflects how strong your core is. So if you've been doing lots of core strengthening exercises, you can go back to this test, and ideally you should be finding that you can hold this position for longer and longer. If you can't, then that's an indication that your core isn't getting any stronger. Now there are other tests available, but they don't tend to reflect core strength in this way. So for instance, you could be really working hard on your planking exercises or doing a whole load of sit-ups, and you might find that over the course of a month your plank doubles in time, or you can do twice as many sit-ups. That's excellent, but that doesn't necessarily mean you have a stronger core. It might mean that you've just developed one side or one particular muscle group and you've neglected all the others. So that one test is the only one that really reflects how strong your overall core is. So hopefully now you have a clearer understanding to exactly what core stability refers to, as well as a few helpful tips about how to identify if you have a weak core, as well as how to monitor your core. As for particular exercises that work on building up core strength, I will be going over that in another video. What I would say though is if you do have an existing bad back, then that suggests that there's been some damage that's taken place. So I wouldn't suggest start doing a whole load of core strengthening exercises just yet, because you might further aggravate things. I would always suggest talking to a professional in that situation. So if you have a bad back or any questions, then please feel free to contact me. So I'll finish up there and I will speak to you later.